MECFS is a dead-end diagnosis with no cure, but some of these conditions do have treatments. This video is part 2, conditions 6 through 10, and if you haven't seen part 1 yet, check it out right here. Links in the card and the description. Hi again, it's Rachel with Survival of the Fatigued. There are a total of 20 conditions I've found so far that can be mistaken as an MECFS diagnosis, and I'm splitting them into bite-sized parts for us severe folks. Make sure you save this video and the others that go with it to a playlist labeled MECFS, so when you have the energy, you can rewatch these and take notes to prepare for when you see your doctor. Okay, saved? Playlist made? Alright, here we go! HIV or AIDS. So HIV often starts with fever, sore throat, swollen lymph nodes about 2 to 6 weeks after you're infected. Then you add rash, chills, night sweats, muscle aches, mouth ulcers, diarrhea, skin sores, infections, weight loss, headaches, and symptoms can hide for years. So yeah, don't wait. Get an antibody test, get an antigen test, or apparently there's also a nucleic acid test. POTS, postular orthostatic tachycardia syndrome, aka dysautonomia. Think like lightheadedness, fainting, brain fog, exercise intolerance, headaches, blurry vision, heart palpitations, tremors, nausea. If standing very quickly makes you dizzy, what you want to ask for is a table tilt test to confirm POTS, or a QSART test if your doctor suspects broader dysautonomia. And don't be like me and just have any doctor try and do the table tilt test. If you have to tell your doctor how to do the table tilt test, don't do it. It ain't worth doing. It'll get you ruled out when maybe you shouldn't be ruled out. You know what I mean? Find someone that has some experience with this and use them. Number 8, mononucleosis, aka activated Epstein-Barr virus, or EBV. So mono creeps in with fatigue, just feeling awful, headaches, and a sore throat that just keeps getting worse. Your tonsils will swell with a whitish coating, and your neck lymph nodes can really hurt. Cruel irony, it can actually lead to MECFS if it's not taken care of. See, Epstein-Barr virus remains in your body forever and reactivates, especially during times of stress. The way you test for this is for current possible mono, you use a monospot test. Or what you'd want to do for a possible past infection is you want an Epstein-Barr virus antibody test. Phew, halfway through. Take a break if you need it, and drop a smiley in the comments to let me know you're with me. Number 9, Crohn's disease. Yeah, Crohn's, the autoimmune gut disorder. It brings constipation or diarrhea, abdominal pain, rectal bleeding, fatigue, nutritional deficiencies, mental fog, poor sleep, anxiety. Plus, it might increase the odds of getting MECFS through all the gut inflammation. So yeah, get blood tests, stool tests, an endoscopy, or just imaging to check your digestive tract. So many of us have like the jackpot of all these, I swear. If we didn't have bad luck, we'd have no luck at all. Number 10. This one took a few takes. I'm gonna spell it out because I don't think I can just say it because YouTube. I'm already shadow banned enough. Number 10, the MTHFR gene mutation. MTHFR gene mutations contribute to MECFS-like symptoms with chronic fatigue, brain fog, depression, anxiety, and migraines, plus possibly also general inflammation and chemical sensitivity. High homocysteine levels are a clue. Test with a blood or saliva sample for the C677T and A1298C variants. Nice. Conditions 6 through 10, done. You're halfway through to the full 20 conditions it could possibly be. Don't forget, next is part 3 and 4. And if you haven't seen part 1 yet, you can find the link for that and all the other videos related to this in the description. Like, subscribe, comment if this helped, and keep on surviving, my friends.